The mitral valve gets its name from a bishop's mitre. So think about the Pope's hat, that pointy top of the hat. That's mitral shaped, and that's what the front leaflet looks like. And the back leaflet has two leaflets. The back leaflet looks like a half moon. And those two leaflets meet together and keep blood from going backwards while the heart is squeezing. If it's not working, you feel very short of breath. And the mitral regurgitation is our medical term for leaking backwards. So first of all, there's a door frame, also known as the annulus. If that frame gets too large, the leaflets don't meet and you can leak backwards. Secondly, the leaflets themselves, if they have any kind of tear or injury, they cannot close properly and blood can leak backwards. And then lastly, those leaflets are kept from going too far back into the left atrium by strings that are attached to them, known as chordae, and those strings attach to the walls of the left ventricle. If a string busts or if the wall of the left ventricle is not moving properly, the leaflets don't go back properly or go back too far, and once again you can get mitral regurgitation. Severe mitral regurgitation will make you short of breath. It can lead to heart failure and fluid buildup. But actually, severe mitral regurgitation can actually not cause any symptoms for years until your heart tires out. The treatment options for mitral regurgitation, first of all, is what we call medical therapy, and that's medicines. We can do things, for instance, fluid pills can make your breathing better, and we can give you medicines to make your blood vessels dilate and make it easier for the valve to work. And then sometimes, if you've had a mitral valve infection, we give you antibiotics during dental procedures to prevent further infection. If we're treating you with medical therapy, that means we think that you have some time before we need to do any kind of surgery or procedure on your mitral valve. And the way we know when it's time to intervene, when it's time for procedure, is either when you develop symptoms such as shortness of breath or swelling or heart failure symptoms, or if the heart starts to dilate and tire out. In those two cases, it's time to fix the valve. The traditional ways of fixing a valve was either a mechanical valve along with Coumadin, or a tissue valve, which generally lasts on the order of 10 years or so. Then the more recent treatments include mitral valve repair, where a surgeon actually has a number of techniques available to save your valve and repair it so that it works properly and doesn't leak. And then most recently, we have new technologies that avoid surgery altogether, the most established of which is called a MitraClip. We have this really great technology. It's evolved over the years, and it's designed to fix the heart without having to stop the heart. And the way it works is we actually go into a vein in your leg, and that vein carries blood up back to your heart. So through that vein we feed a long, thin guide wire. And so we cross from the right atrium through a wall called the septum into the left atrium. And the left atrium sits right above the mitral valve. And from that position, we can repair the valve with a MitraClip. It has two arms, and actually each arm is a double arm. And I like to say it's like clothespins tied together at the nose. And these clothespins open up, and they grab both leaflets, and they pull them together. And so they bring the anterior mitral valve leaflet next to the posterior mitral valve leaflet and right in the middle. And with that, the leaflets don't come back too far. There's not much space between them, and it treats a leak. It actually will reduce mitral regurgitation. If it hasn't fixed the leak enough, or if it requires a second clip, we can either reposition the clip or place a second one. And we don't stop until we are sure we fixed the valve and we have adequate resolution of regurgitation. Some of the advantages of this technique include we can work on a beating heart. So there's no need to stop the heart, there's no bypass, the brain's getting blood flow the entire time. The second thing is it's very low risk. In the actual trials, there were no deaths in the intervention arm versus surgery. Death is rare, but it can happen. The other advantage is recovery. Because we don't open the chest wall and we're going into a vein, the vein is sealed, and you're walking around later in the day or the next day, and you're probably in the hospital another day or two, versus traditional surgery recovery is much longer. So the recovery is very quick. So how do you decide which procedure to have? It's actually a very complex decision which takes a whole team to think about. If you're someone who is young and would need a valve for a long time, we believe repair is the best way to go because it's your own tissues. However, there are some valves that cannot be repaired. So again, a younger person whom you expect the valve to last 20, 30 years or more, a mechanical valve really is the best option. If you're older and repair is not possible, a tissue valve works really well and lasts a very long time and is a very suitable replacement. And finally, if it's at all possible and a good surgical repair is not simple to do, the non-invasive approach is becoming a better and better way to fix things. But it takes a particular type of valve to fix. The jet or leak has to come from the middle of the valve. If it comes from one side or the other, the clip will not be adequate to fix it. And the leaflets have to touch one another enough for the clips to catch them. So if the leaflets are too far away, we cannot fix it either. So basically there's a lot of decision making that goes into evaluating who can benefit from repair or replacement or MitraClip. And so one of the great things about our approach is we have a team. We have a surgeon, we have imagers, we have invasive cardiologists, and we also have the patient, which is most important. We look at them carefully, we discuss all the options, and we would expect you to help us make the decision for something that works best for you.